right, so I basically begged Louise and Tammy to give me something to talk about because I'm taking a speech class and I figured it would be easier to do something that we could all talk about in the workplace. So they told me that it would be a good idea to talk about meaningful use. I did not even know what meaningful use was when they brought that up to me, so I'm guessing it's a good idea. So I looked it up, and supposedly meaningful use is a government-driven program where the government gives our office a set of standards and says, you need to meet these standards or you're going to lose money. And none of us like losing money because that means our paychecks are on the line, right? So that being said, we get specific guidelines that we need to meet as an office. And if you go to the CDC's website, healthit.gov, or the Centers for Medicare and Medicaid Services, you can actually see some of these specific guidelines on their websites. But like I said, failure to meet the guidelines does result in penalties to us, and we don't get paid if we don't meet the deadlines. So that being said, what is the purpose? Why are we trying to do this? The purpose is, according to the CDC and healthit.gov, it rests on 5 pillars, and the 5 pillars are improving quality, safety, efficiency, and reducing health disparities. Engage patients and families in their health care, so we're getting the patients involved in their health care process. Engaging the care coordination between physicians, so what we have on our screens at one office, we're able to actually, because we have electronic health records, get over to other offices. Improving population and public health, ensuring adequate privacy and security protection for personal health information. So big one, HIPAA. We're keeping our patients' information more secure by doing it electronically. What is our part in this? Now, our part kind of goes into 2 different phases. We have phase 1 and phase 2. Phase 1 is data capturing and sharing. This phase requires meeting both core and menu objectives. And like I said, if you go to the Center for Medicare and Medicaid Services websites or healthit.gov, you can actually see some of those standards that we're meeting, and you may not even know we're meeting those standards on a daily basis, but it's stuff that we put into practice every day. Now, stage 2 is something that we need to work on as a practice. Stage 2 we've looked into, and we didn't do so well on it, and we may have lost some money because of it last year, so let's try to do better this year. I think we lost about $10,000, if that tells y'all anything.
Per provider.
Per provider. So that's kind of a big deal. But things that we can do, mainly that's why I made this poster board, is because there's 2 big things that we can do as an office that doesn't even have anything to do with the physicians, that starts when the patient walks in the door. The first thing that we can do is medication reconciliation. Now that is kind of a big deal because 2 parts, both must be done to get credit. There's 2 different parts of it. The parts of it show up on our ECW screens when the patient walks in the door. And I'll leave this poster board up here in case you want to look at it later. But the 2 parts is like when Amber or somebody at the front desk makes an appointment and the patient comes in the office, there's a box on there that should be checked that says transition of care. Now she has to check that box. And if she doesn't check that box, then it goes over to triage. When triage is in the room doing the medication reconciliation, they actually have to click verify. And anybody can click the transition of care box. I just had to do it for the first time the other day after I looked into it and realized that it was something we were kind of missing the ball on. So maybe something to look at is making sure that we're getting that box checked when the patient comes in the office. Also, other than that, like I said, when the triage people are in the room doing the medicine verification, you have to make sure it's under the ECW screen, progress notes, chief complaints, and the transition of care. That box needs to be checked, transition of care. And then also under the medication reconciliation, the box under there needs to be clicked that we have verified the medication reconciliation. If that has not been done, then we lose credit and we miss out on that. So that's a big deal. Now the second part is patient education. This is something else that we do every day, but we're not getting credit for. Anytime we start a patient on a new medicine, anytime we're scheduling them for a procedure, anytime we're admitting them to the hospital, there's all these things that go into that we need to be giving them education for, and we do it. I see all of us do it on a daily basis. We do echoes, we do stress tests. They all know what they're about because we're telling them. However, we're not getting credit for any of that because we're not documenting it properly. So the way to document properly that we are doing patient education is actually also in ECW. Now, when we're under our treatment screen in ECW, we have to click under the education, and it's a little drop-down tab, and then you either have to click patient education or RX education. If you don't click one of those two, it does not count. You can't click custom education, or you can't click the other box that says RX reference, it doesn't count. And then there's two ways that you can actually do that. When you click on the patient education, it brings up a screen, and I just did this for the first time the other day too, where each of your diagnoses that you have listed actually have different educations listed that you can hand out and give to the patient. So if it's a patient who comes in after having an MI and needs cardiac diet information or needs information on stents or anything like that, it all comes up under there, and you can just print it out, or you can click a button that says publish to portal. Now that is the preferred method, that you publish it to the portal, because we have a documented record. If we print it out and hand it to the patient, that's great. They need the information, but if you don't click to publish it to the portal, then we're just relying on the fact that the patient's going to check the box when they get a survey in the mail saying that we've given them education. And we all know how that goes with older senile patients who don't remember what they've gotten from here 6 months ago. So that being said, I'm going to leave this poster board up here. I hope that it was somewhat useful information that I gave you guys today, because I really didn't know what a lot of it meant when they were explaining it to me. If you have any questions, I'm sure myself, Louise, or Tammy would be happy to answer them for you. And thank you guys so much for taking a minute out of your day to listen to me.